So when we're discussing measurement for improvement, despite the fact that we measure a lot in general practice, we often don't consider carefully what we're measuring. We feel there are three main types of measurement, and those are outcome measures, so that's what happens at the end of the day. Process measures, which give you a measure of what's actually happening, the internal workings of your practice and the internal workings of your ability to deliver care. And then a balancing measure. And a balancing measure is something we often don't consider. And it's an unwanted or counterintuitive effect from the change you're bringing in. And people describe it as if you have a balloon and you squeeze one end, the air's got to go somewhere and it will squeeze out the other end. So if we're bringing in an improvement, say we're bringing in, for example, tighter blood glucose control for our diabetic patients, a process measure might be how often we're getting the patients into surgery as an indication of our ability to care. An outcome measure might be HbA1c's lower than 7%, so we want an actual outcome of glucose control. And a balancing measure might be the number of hypoglycemic episodes our patients are getting, because as we're driving their sugars down, we're having more, or you're potentially having more unwanted effects. So the balancing measure of that tight glucose control would be hypoglycemia. And it's important to consider the three aspects of measurement when you're planning an improvement project. What is it that you're going to measure? Are you measuring an outcome, so the final thing? Or is it more relevant for you to measure what's actually happening within your practice, the internal workings, which would be a process measure? And don't forget that changes you make can have negative consequences as well as positive consequences, and that's the importance of the balancing measure, to make sure you're not upsetting the system in an area that you're not thinking about in your improvement project.